That process takes about 20 minutes, and then we're going to come and do the injection. We do that under guidance, so we know exactly where we're putting it. And PRP is basically where we take your platelets, which is a fragment of a cell that's in your bloodstream. Those platelets help us stop bleeding. So when we injure an area, those platelets will go to that area and they clump up. And not only do they stop us bleeding by obstructing the blood flow to that area, but they also release a lot of healing into that area. And what we use platelets in regenerative therapy, we concentrate them very highly and then inject them in and around a joint. In this case, we're going to inject around your joint as well as inside your joint. So when we do PRP, there's a couple of things we can expect. We can expect a blood draw. And typically, we'll take about 120 cc's of blood for one joint. That's an easily replaceable amount of blood. It doesn't cause any problems, although we do want you to hydrate when we do PRP. When we do PRP, there's a couple of things to realize around the injection itself. Anytime we do an injection, there's a slight risk of infection, right? So if it gets big and red and swollen after we do the injection, we got to hear about it immediately. It's very unlikely with regenerative therapies that are using your body's materials because there's not a rejection. It's very likely that we're using the cells that actually fight infection. So pretty low risk with these types of injections. Now, we can feel some swelling or pain around the injection site for about 3 to 5 days. Some people say up to a couple of weeks. In most cases, PRP is a little bit more uncomfortable than something like a stem cell injection. But PRP works pretty rapidly as well. PRP will typically start to feel better within about 3 to 5 days to 2 weeks. The average relief that our patients see in a joint like this is between 75 and 85% reduction of symptoms within just a couple of weeks. And PRP continues to improve the joint for 3 to 5 months. The average length of time that regular PRP that's done in another office would last us between 18 and 24 months, and our PRP tends to last quite a lot longer. We also combine it with other substances like stem cell or some other types of injections that we do. Now, after we do PRP, it's important to take a little bit of a time to rest. So I do want you getting up and moving, so we'll move the joint around, sort of an active movement within just a couple of hours. And the next couple of days, I want us to do a little bit of a walking program, moving the joint around without a bunch of weight on it. So we're not going to lift a bunch of weights. I don't want you running a marathon, right? So we don't want to be doing that. We really want to be supportive of the joint. So those supplements, we want to take those cartilage supplements. We want to have a great anti-inflammatory diet. Remember, if we put garbage into the system, we get garbage out of the system. So PRP, it's super critical to make sure that the diet is nice and clean. The other thing that's really important for regenerative therapies, if we're using your cells, our cells respond to our mindset. That sounds a little bit woo-woo, right? Like, oh, I'm going to meditate my way into health. In fact, you can meditate your way into health. Yogis in India do it all the time. But in this case, we really want to have a positive mindset around the use of our cells because we can focus and direct some of the actions of our body. And if we're thinking positively about our outcome, then that's going to really help. So sitting down for 10, 15 minutes a day to kind of quiet the mind away from any sort of input like phones or, tablets, computers, the news or bad news or whatever, taking some time to really focus on your health and how you would like to feel, right? I want to feel this way. I want this joint to feel this way. And focusing on that, giving some time and attention to that every day is going to be really powerful. It also helps our cells to kind of know what they're doing because our cells know us, right? And that sounds a little woo, but it's actually true. Other things that we can do, we can hydrate 2 liters of water a day. In hot weather like we're having, a little bit of electrolyte in the water. And then also making sure that we're doing heat and not ice. With PRP like this, we want to avoid substances like anti-inflammatory medications, ibuprofen, Aleve, or aspirin. We want to stay away from those things because those can inactivate platelets and make our treatments less effective. All right, it makes sense?
Yes, it does.
Okay, so today we've already taken the blood, we're processing it. That process takes about 20 minutes, and then we're going to come and do the injection. We do that under guidance, so we know exactly where we're putting it. Okay. All right, and after we're done today, we're going to start your other therapies. So we do red light laser, we do functional strengthening, and we'll follow you for your diet and exercise and also your supplements. All right?
Sounds good.
Very good.